Another video on findings mode. So as a background, if you've never used the findings mode, you can kind of think of dictation. There's kind of two ways to do it. One is freeform, where you start with your findings mode completely blank and you just dictate completely from scratch. In that case, findings mode is not going to be helpful for you. This is more meant for people who use macros, which I think is the majority of people. One of the cons with macros is that for every abnormal section, you have to highlight and dictate individually for each separate section, which can become tedious if there are multiple abnormal sections. You might have to highlight the gallbladder, describe the abnormalities of the gallbladder, highlight the kidneys, describe the renal cysts, highlight the uterus, and then say that the uterus is surgically absent, for example. Findings mode attempts to bridge the two where you can dictate in freeform mode and the system will pick up trigger words that you program and it will take individual sentences and based on those trigger words will put those sentences and populate them wherever they're supposed to go. So you can dictate in whatever order that you want in this findings mode. So that's in general how findings mode works. So I'm going to go into the auto text editor and I'm going to pull up a macro here. Here's a CT abdomen pelvis. This is actually Dr. Gad's macro since he asked me to do this video. So you notice multiple fields in red here. Powerscribe uses two different types of fields. One is this merged field. This is not going to be relevant to findings mode. This is just auto-populating things like patient date of birth, admission date, things like that. So those populate automatically. What we are going to be paying attention to is this fill-in field section. So if you already have a macro kind of built out, we're going to go just a few of these and we're going to show you how you would turn these into a findings mode compatible macro. So I'm going to take this first sentence, I'm going to cut it out. I'm going to go up here to where I want to put it and I'm going to click fill in mode up here, or fill in field. I'm going to name the fill in field the same as the normal sentence, and in this default box I'm also going to put this paste that there. So hyponyms are the same thing as trigger words. So in this lung section, I want to ask myself, what are words that I'm going to use to describe abnormalities in the lungs that I'm not going to use in other places? Okay, pretty simple, atelectasis and consolidation. So this is going to tell Powerscribe anytime it detects a sentence with the word atelectasis, I want you to put it in this box. So you can use one or both, or you can use both in separate sentences. So you can say, for example, right lower lobe atelectasis, period, left lower lobe consolidation, period. It will take both of those sentences and put them in the same area. Okay, so now we have our first fill-in field. We're going to generate this next one here. So I'm going to highlight, I'm going to cut, I'm going to put my cursor where I want to put it. Then I'm going to click fill-in mode. Just paste here for the title, paste for the default. Then once again, I'm going to ask myself, what are abnormal trigger words that I use to describe the heart that I wouldn't use in other places? So for example, I wouldn't want to use the word enlarged here because you might also say the liver is enlarged or the spleen is enlarged. So the word heart, I'm not going to use that anywhere else. Maybe coronary artery disease, so you can put coronary here. So those are the trigger words for the heart. Click OK. One more here, we're going to do this pericardial and pleural effusion. Put it where I want, put my cursor where I want the box to be, click fill in field, paste for the name, paste for the default. What are my trigger words here? It's going to be pleural, it's going to be pericardial, it's going to be effusion. Maybe I could throw in empyema. Those are my trigger words. Then delete the extra space here, save it just like any other macro editing. All right, and then I'm going to pull up the macro. Just like if this was a regular report. You can see these first three sentences are bracketed by these red brackets to indicate that these are fill-in fields in findings mode. So I'm going to click down here. I think this is within the screen capture window down here on findings mode. So you can see there's a couple of different areas. There's properties. If I click that, a different little box comes up here. There's properties, fields, notes, and attachments. You want to be in the fields section. Then at the bottom left, a little clickable link comes up here that says enter findings mode. Once you do that, this findings only box pops up. So when this box is open, whatever you dictate will only go into this findings mode box. It will not dictate out here. Macros will. So if you have like short macros that you use within these templates and you say macro, for example, I have a macro prostate, it will put that out in here. But for the regular dictations, it will only go into this findings mode. So I'm going to turn on my microphone. Right lower lobe subsegmental atelectasis period, left lower lobe consolidation period. The heart is enlarged period, small pericardial effusion period, moderate pericardial effusion, pleural effusion period, coronary artery disease period, small empyema period. Okay, I turned off my microphone, but if I wanted to, I could have just said apply findings and it will do its job, or I can click down here on this left side, apply findings. I'm going to click exit findings mode here. So you can see that box went away, and now I'm back into just normal dictating the way that you're used to. But you can see that it took the word, the sentence with the trigger word atelectasis, put it here in the lungs fill-in field. Same with the consolidation. Same with that heart is enlarged. And you notice coronary artery disease, it was the last thing I dictated, or next to the last thing I dictated. It didn't matter. It puts it in the right place regardless of what order you dictate things with. So everything went in its appropriate area. You can see this long sentence here that has multiple abnormal organs. This doesn't work so well for findings mode. For example, if I set this up as a findings field and I said the liver is enlarged, period, the findings mode would replace the entire sentence. So you have to say the liver is enlarged, comma, however, comma, the gallbladder, spleen, pancreas, on and on. You'd have to describe all of them. So it's much easier just to put them each in their own findings, their own fill-in field. So you could just say the liver is enlarged. It would just replace this portion, and you would still have the rest that says the gallbladder is normal, the spleen is normal, etc. Findings mode works best if you use a more conventional style of dictation where you are more descriptive in the findings and more conclusive in the impression. For example, I was used to just saying cholecystectomy here in the findings and saying the same thing down in the impression. But if you set up cholecystectomy as a trigger word, then it doesn't know where to put it. So instead, I just have gallbladder as a trigger word for my findings section, and I have cholecystectomy as my trigger word in the impression. So for example, I would just be dictating in findings mode, and I will say surgically absent gallbladder, period, cholecystectomy, period. And it will put cholecystectomy down here and the surgically absent gallbladder up here. The same thing with appendix. You would set up appendix as the trigger word for the findings section, and you'd set up maybe appendicitis as the trigger word here for the impression. So when you're dictating, you'd say the appendix is dilated, comma, fluid filled, comma, with wall thickening and surrounding edema, period, acute appendicitis, period. And it will put one sentence up here and one sentence in the impression. So once you get the gist of it, you can obviously set it up anywhere you want. You can even use it for things like DLP up here, where you'd set this entire area as the DLP, as the fill-in field, and you would just say DLP 1900, period, CTDI 50, period. And although, since it has to be separated by periods, it's a little bit bulky because you don't normally put a period there, but you can set, that is one way you could use the findings mode here for the radiation dosimetry. The same thing for comparison. If you use comparison as a trigger word, you could use that here. So there's lots of different ways you can do it. It is helpful, particularly in examinations where it's mostly normal with a few scattered abnormalities, which are kind of typical. That's findings mode.